Good afternoon, everyone. My name is Bailey Merrifield, and I am one of JRSA's research analysts. For those of you less familiar, JRSA stands for Justice Research and Statistics Association. Before we go any further, I want to thank our partners at the Bureau of Justice Statistics for helping to make this webinar possible. With that, it's my pleasure to welcome you to our webinar, Reducing Substance Use Disorders and Related Offending, a Continuum of Evidence-Informed Practices in the Criminal Justice System. Our presenter, Lily Gleicher, joined ICJIA as a research analyst in the Center for Justice Research and Evaluation in July 2016. Her research interests include implementation and sustainability of evidence-based practices, correctional treatment and rehabilitation, mental and behavioral health, and criminal justice and correctional policy. Lily received her bachelor's degree in political science from the University of Connecticut and her master's and doctorate from the University of Cincinnati with a concentration in corrections and criminal justice systems. Recently, Lily conducted an outcome evaluation of a police treatment program, a recidivism study of youth living in the Illinois Department of Juvenile Justice, and also assisted with an evaluation of Logan Correctional's dual diagnosis program. Welcome, everyone, and with that, we will get started, and Lily, I will pass the ball to you.
All right, so can people hear me?
Yep, you sound great.
Okay, good. I just wanted to make sure. So hi, I'm Lily Gleicher, and just like Bailey said, I'm going to present to you something that our agency did as a way to kind of help for local planning and really kind of to help summarize some research on substance use disorder treatment, but also treatment for justice-involved individuals. So I'm a research analyst for the Center for Justice Research and Evaluation at what we call ICJIA, which is Illinois' SAC. So to give you a little background, for those that also come from SACs, we do a lot of the same stuff, research and analysis, but at ICJIA, we're lucky enough to have not just our SAC, but also our state administering agency within the same agency. So we all work together as well. But ICJIA's mandate is to bring key leaders, stakeholders, and the public, to identify critical issues facing the criminal justice system in Illinois. And we propose and evaluate policies and programs to address those issues. And our responsibilities include grants administration, which is our SAA, and research and analysis. I like to say that's me. And that's my part of the agency, and then policy and planning. So to kind of give you a little bit of background as to what I'm going to go through today, what I first and foremost like to do is identify and have the same definition that we're all speaking of for evidence-informed and evidence-based practices for substance misuse and substance use disorders. Predominantly, I'm going to be navigating in the continuum to kind of show you guys who may have not seen it before or may have want a little bit more tutorial on it to how to navigate that continuum and helpful things within that continuum. I'm also going to highlight key topics and kind of discuss how you can translate this continuum to guide local level assessment, planning, and implementation efforts for those that are justice involved and dealing with substance use or misuse. And so just to kind of give you the definition that we have on the continuum, which I just kind of put in here, is kind of just three basic levels. Anecdotal or not evidence-informed or not evidence-based. So where there's little or no evidence through use of reliable, replicable, or generalizable research, indicating the programs achieve what they are intended to achieve. So we consider that no effect or unknown effect. And then evidence-informed, where there's some evidence through the use of reliable, replicable, and generalizable research, indicating programs achieve what they are intended to achieve. We also consider this something like a promising practice. And then evidence-based, where there is strong evidence through the use of reliable, replicable, and generalizable research indicating the programs achieve what they are intended to achieve. So strong evidence including, randomized controlled trials or meta-analyses of programs and practices or systematic reviews, things like that, where there's a lot of information we can use to solidify the evidence for that program or practice. So this is what we would call an effective practice or best practice. And this is generally taken from crimesolutions.gov, but some other great kind of discussions of level of evidence you can also find on other websites. So now I'm just going to take you to the continuum, and I'm just going to connect my desktop. So before I go to the continuum, I have to give kind of a shout out to Policy Research Associates. So what I did was I based this continuum off of the sequential intercept model. And so for those who might not know what we also call the SIM mapping or SIM model, but I based my continuum off of these intercepts that Dr. Mark Muniz, Dr. Patricia Griffin, and also Dr. Henry Stedman with the Policy Research Associates. And it was developed as kind of a conceptual model to inform community-based responses to involvement of people with mental and substance use disorders in the criminal justice system. So they really kind of created this mapping or modeling process. Now, this is a map that they have come up with, Intercept 0 being prevention or the community side prior to any sort of criminal justice contact. And then Intercept 1 is generally pre-arrest. Intercept 2 is generally an initial detention or first court appearance if they've already made it to that point. Intercept 3 consists of jails and courts. Intercept 4 considers reentry from jail or prison. And Intercept 5 looks at community corrections, so parole and probation. What we did with this continuum is we not only looked at reentry for jails and prisons, but looked at also programs and practices that could be conducted within the jail or prison. And I can send this link out too, but what's kind of nice is they have this update of key issues at each intercept to consider. So think about these different kind of key things from prevention through reentry, and what do some of those kind of general things look like. And so using this model, what we tried to do at ICJIA was come up with kind of a macro level SIM model as to what do we currently know or what's the state of the research on practices within each of these intercepts. Kind of as a way to help consolidate a lot of the research that, some practitioners or policymakers might not be able to gain access to, and also like a way to kind of summarize the information. So what's great about this continuum is that whether you're a provider, like a criminal justice professional practitioner, a stakeholder, or policymaker, this tool can really help provide guidance and summary of programs and practices that are evidence-informed, in addition to helpful resources that I've linked throughout the continuum. This is actually the second iteration. As you can see, it was updated in April of this year. And we hope that as new research comes out, that we continue to update this continuum with new information. And that's what we did in this last update was new research came out, and we wanted to make sure that we have the most up-to-date research. Second here. Now, I want to note that this continuum is comprehensive but not exhaustive. So it may not have everything out there, but we really tried to get at all of the different pieces. The one thing that people may note is that this continuum does not include recovery support services. not to negate the importance of these services for successful treatment and really recovery, the recovery process. This is something else that we're looking to potentially do through something else, but that note that those are also very important, especially for reentry and especially for someone leaving a jail, prison, or a residential facility as well, or even, you know, a sober house or whatnot. So the beginning of this is really what I want to show you, just kind of how it's navigated, and then I'm going to highlight a couple of topics. So this introduction here just kind of identifies the state of substance use disorders, the state of among the population and within the criminal justice population, the number of people that actually receive treatment, and it kind of goes into more of, well, what do we know about substance use disorders? We know it is currently a public health issue, if not a crisis, and that there are different treatment models. Some are more effective than others, and that really what this continuum does is collect research and rigorous evaluation that provides the insight for effective practices. So you can also see that defining practice, evidence-based practices terminology on here as well. And in addition, we have evidence-based risks and protective factors, which are thorough in individual, peer, family, school, and community, as well as protective factors. And of course, list of references if anyone feels like reading those. But most importantly is this intervention at criminal justice intercepts. So what this does is this will pop up. It should be popping up. Sorry, guys. Okay, popped up. So what this does is at each intercept, it has a different box. And what this tells us is just kind of a summary of what this intercept is. And this is intercept 0, prevention, intercept 1, law enforcement, intercept 2, initial detention, initial court hearings, 3, courts and jails, 4, I-titled institutions and reentry, because I incorporated both, and then 5, community corrections. And so what I wanted to kind of highlight as to how these work. So in each of these intercepts, you'll find different types of programs or practices that would be fitting in that intercept. Now, there is some overlap with programs and practices in different intercepts. That's okay. But ultimately, what you'll see is there are some that can be brought continually through different intercepts as well. So for prevention, we're looking at this just to kind of give you an overview of what's in each of these types of things. The first thing these little boxes do are provide a program description or a description of types of programs, the goals of those programs, and usually the eligibility of those programs. And some of these are specific to programs in this section, but what we've done then is link to the program website or a web page that has information, and it gives you a general idea of what each of these programs are and the research findings, and it'll note if it's a promising program or an effective program. So you'll see here, this is also promising, etc. So what I'm going to do is kind of come back. And so some of the things I wanted to highlight were first, deflection and diversion initiatives. So this really kind of fits into intercepts 1 and 2. So there's been a lot of discussion and collaboration among law enforcement, treatment providers, and other important community-based agencies that help individuals navigate treatment, navigate recovery, and whatnot. So these deflection initiatives and pre-booking community-based diversion right now are currently evidence-informed. And that's because there's still limited research out there. However, what some of the research does suggest is that these can be a great access point to substance use services. So what this kind of does is give you an overview of law enforcement deflection initiatives. So individuals without fear of arrest can ask for assistance in receiving substance use treatment from identified law enforcement agencies. And generally this comes with a law enforcement officer taking an intake, connecting them to a clinical provider that can do a clinical assessment of the individual, whether that's on site or at transport. And these initiatives really are featured on collaboration between law enforcement, communities, hospitals, public health providers, substance use treatment providers, and other community service providers. So they're very collaborative types of initiatives. And really the purpose, some of the goals: intervene in the cycle of substance use and potential crime or criminal justice involvement, improve public safety. I would also add in here, improve the quality of individuals' lives as well. And here's some departments and how they've selected criteria, but these things can differ. So I provided some examples, some links to those examples. Some of the articles, this is an article that ICJIA drafted up on the different types of roles that law enforcement can play with drugs. And then also COPS had a great article on building successful partnerships between law enforcement and public health as well. And for pre-booking community-based diversion, this is where they exercise discretion to divert individuals in lieu of standard jail booking, where there's arrest protocols, but then the charges are held in abeyance, and the individual gets a case manager who generally facilitates an entry evaluation and refers them to a variety of services. This can include, the substance use treatment services that are appropriate for that individual, housing, job and educational services, legal advocacy, and or counseling. And these are some of the goals as well: improve public safety, improve public health, reduce reliance on formal criminal justice processing, and really long-term behavioral changes, which may or may not include complete abstinence. So also the integration of harm reduction approaches rather than zero tolerance approaches. And so one of the biggest examples of this is law enforcement assisted diversion, the LEAD program out of Seattle. And they have a couple of peer-reviewed articles, but also they have those reports on their website, which I've linked to all here. It's a promising practice, and even since its inception, they have made some changes where it is now more deflection or prior to arrest, and to kind of incorporate multiple models of deflection and diversion. And then here are just some other resources also on those types of programs. The second thing I wanted to highlight was really the risk-need assessments versus clinical assessments and the utility of those within each sort of, within identifying resources and services for individuals that are justice involved that have substance use disorders. So this includes things like cognitive behavioral therapy. So as you can see, there's pre-booking community-based diversion, which is the same as also as you've seen in Intercept 1, because they can kind of intermix within those intercepts. Intercept 3, courts and jails. We outlined jail or court-based programs that have evidence behind them and how they can be used in the community and within facilities. So to give you an idea about what I'm talking about with risk needs assessments and clinical assessments is that it's important that eligibility is based on whether or not someone actually has a substance use disorder, but that also that can be identified up front. So for professionals in the criminal justice system, you use a validated risk needs assessment. I know in Illinois that is changing to the ORAS and OYAS, or the ARA and JRA out of Ohio, but that these are also other systems of risk needs assessments that can really help identify to the probation officer, parole officer, jail intake officer, prison intake officer, anyone, where their high needs are. So what are those high need areas? And once, if substance use has been identified, it's then that you want a clinician or a medical provider to really provide a clinical assessment of where that individual is with regard to substance use, and also what would be the most appropriate types of tools to use, but also what are the most appropriate services that could be given to this individual. You know, not everyone needs detox, not everyone needs a residential facility, so where does this person fall, and what can, you know, they do to help connect them to appropriate services. So we also provide research findings, so this is for drug courts. There's program examples and different national and Illinois-based websites can really look to see some of those models in action. But for all of these different Intercept 3, Intercept 4, Intercept 5, and even Intercepts 1 and 2, a clinical assessment is key because really there's kind of a continuum of what someone might need in relation to substance use disorder and other recovery support services or other needs like housing, transportation, and the like. So this continues on with cognitive behavioral therapies, but I wanted to highlight pharmacological methods, which is just medication-assisted treatment, but to kind of highlight that first and foremost, medication-assisted treatment incorporates the use of medicine to treat opioid or alcohol use disorders in conjunction with behavioral therapies or counseling. Opioid use disorders have a specific set of medications, and each of those medications have a different research base, and same goes for the alcohol use disorders as well. So right now there is a lack in access to MAT, specifically within jails and prisons, and there's also you know, some hesitation, I think, from practitioners, CJIA practitioners, to sometimes allow this as part of a treatment program, and even judges as well. But I think the more informed, the better, which is why I think this continuum can be really helpful for policymakers, you know, and really anyone that sees someone with a substance use disorder in the criminal justice system. So MAT help programs help with treatment retention and abstinence by decreasing withdrawal symptoms and cravings, increasing quality of life, reducing risk of HIV and hepatitis C, reducing risky behaviors associated with substance use, and as well as decreasing risk for overdose. MAT programs can be in the community, like a healthcare office, methadone maintenance clinic, or what we call, at least in Illinois, an opioid treatment program, primary care physician's office, or in correctional settings, which which is also discussed in the correctional intercept. And so the medications to treat opioid use disorders, buprenorphine, which is probably most likely heard as Suboxone or Subutex or Buprenex, but that is one of the gold standards of medication for opioid use disorder. This gives you information on who can administer it, how you can administer it, and where to get access to becoming a buprenorphine provider. Methadone, also one of the gold standards for opioid use disorder treatment, helps with adverse side effects, reduces physiological cravings and withdrawal, and is first administered and monitored by a physician, but can be obtained through an opioid treatment program, which is where most people obtain them, which has to be certified through SAMHSA. And then naltrexone, which most people know in the form of Vivitrol, which is one of the newer medications out there. And any healthcare professional that's licensed to prescribe medications can prescribe naltrexone without additional training, whereas the other, methadone and buprenorphine, provide substantial training behind them. Naltrexone also comes in a pill called Revia, but that is not indicated for opioid use disorders, and they did some testing where they found that the Revia the pill form of it was more effective for alcohol use disorders, and initially naltrexone was created to treat alcohol use disorders, but was also found to help with opioid use disorders. So medications to treat alcohol use disorders include naltrexone, which is the general name for it, but that you could use Revia, and I believe Vivitrol as well, disulfiram, which is commonly known as Antabuse, and acamprosate, which is a drug taken orally that helps reduce cravings. And these are all in and of themselves helpful, but even more beneficial when behavioral therapy is also done in conjunction, and of course when you have a recovery support network. So this again goes through eligibility, again, tools for clinicians, and then tools for risk needs assessments for justice-involved individuals to get a further assessment by a clinician. And also there's parts of the medical settings like hospitals and primary cares where physicians can also ask patients about this type of substance use and whatnot, although there is some controversy with having that information due to some of the protections of that information. But based on the research, medications to treat opioid use disorders can decrease heroin and other opioid use, decrease in crime and criminal behavior, improve social functioning, physical symptoms, and improve maternal and fetal outcomes for women who are pregnant or breastfeeding. And the same thing goes for buprenorphine, with more limited research-based outcomes for naltrexone. And then it goes through each of these as well. For Illinois, there's examples in the field in Illinois, but also the SAMHSA buprenorphine treatment physician locator, the OTP program directory for Illinois, but also a ton more information on pharmacological methods or therapies for opioid and alcohol use disorders. The last thing I really wanted to highlight for the continuum is the continuity of care. So, briefly kind of discussing that people coming out of institutions, whether that be jail, prison, or residential facility, even a sober living house, into a more independent living situation, that it's important that there is continuity of care and that there's transition built in. So, handing someone a piece of paper with a bunch of numbers may feel very intimidating and may not be very useful for continuity of care. Some of the best continuity of care, at least for MAT in jails, can be found at Rikers, and how individuals are directly connected even prior to their release or at the day of their release to a provider if they're on medication, and to other community-based programs. But the biggest thing I wanted to note is that while this falls at the bottom, it is also really important, and that it's imperative that evidence-informed really includes some rigorous evaluation, and that research proves or provides support that the practices and programs components have produced significant replicable positive outcomes, and that ultimately those outcomes are predicated on implementing these with high degrees of fidelity that can help improve and save lives, as well as improve public safety decrease taxpayer money and criminal justice expenses as well. So though there might be a lot of upfront planning, organization, and kind of oversight of the processes, it can be an iterative process where you're continually assessing for how well it's doing, if you're meeting the needs of the individuals and the like that you work with. So criminal justice professionals, in conjunction with other policymakers, stakeholders, and providers, can be more effective at reducing recidivism and substance use with limited use resources when they use initiatives that have been shown to work. This continuum outlines several ways in which schools, communities, families, law enforcement, courts and supervision, and correctional institutions can refer, divert, and treat individuals with substance use disorders based on evidence-informed practices, and then offers the research resources and examples. But prior to implementing any sort of substance use disorder treatment or substance misuse treatment, or really any programming, is getting the scope for capacity and quality of current programs and what that might mean for future programs. So what are the capacity and quality of these treatment and services in communities and in correctional institutions, in addition to the use or adherence to evidence-informed practices? So not just that there's a manual that has evidence-informed practices, but what does it actually look like in practice, and are facilitators getting to the core criminogenic needs or risk factors while also helping increasing protective factors for that individual? There's also the potential for net widening, so the potential to inadvertently increase the number of individuals under criminal justice control that would not otherwise have been under criminal justice control. So potentially putting low-risk individuals into maybe programs that have more moderate, and high-risk individuals, including like a drug court. Most important is collaboration between criminal justice professionals, treatment and service providers, policymakers, and stakeholders. It's really necessary for successful deflection, diversion, and intervention, really at any point in the system, because without it being systemic, it's hard to make that kind of change. And that in order to kind of get that buy-in and make that change is that criminal justice professionals should be formally trained in behavioral health and mental health, behavioral health being substance use disorder and mental health, but also substance use disorder is also a mental health disorder, with a specific understanding of substance use disorders. Of course, as a researcher, I would like to see continuing research regarding current and new substance use disorder and substance use treatment and service models. Many practices do not have enough research to consider them evidence-based, maybe only evidence-informed, and in some cases, really just limited evidence. And despite evidence, participation or use of an evidence-informed program or practice may not be adequate to address all of an individual's needs. So therefore, I recommend that it is important to consider multi-model, individualized treatment plans when implementing substance use disorder and substance use treatment models, programs. And I think this will also be reflected in the October presentation on the Continuum of Mental Health Disorders that was created by one of my colleagues. And that some of these programs and practices also can be dual diagnosis programs with the addition of certain programmings, medication monitoring, and that type of stuff. Make sure that a program or practice is an appropriate fit and addresses a relevant need in the community. And that's kind of why I recommend going through the sequential intercept model to see, like, what do we have, what are we hearing our needs, and how do we know these are needs, and then what might need to either fill that gap, or how can the resources be best used to treat those individuals. I keep saying these are each the biggest, but I'm an implementation and sustainability nerd, so planning out the implementation and what sustainability may necessitate is really important for successful implementation. So funding, what would the funding need to be like? Do you need to diversify funding streams? What would the programming consist of? Would you have to pay for training? Do you have to train in-house staff to be trainers? What types of staff should you be training, and what the training is in general? and that really all levels of an organization need that information in order to make it a successful program. So administrators also need to really know what this means for line staff and consider what this means for line staff and what it means with current policies and practices, and whether there's any conflict in those policies and practices that maybe don't align with what's evidence-informed or evidence-based, and how to work with that. And that also noting that implementation is a process that takes time. I always recommend, and I think anyone at ICJIA and our staff would recommend, that you collect data to inform your organization about what is going on, what changes may be necessary, and to assess whether there's fidelity to the practice or program. So things like quality assurance processes and continuous quality improvement. And this is really key for sustainability. You don't have the data to kind of help inform what the population is you're serving, what types of people you're seeing in your organization, and being able to meet the needs of those people, then while you may be implementing an evidence-informed practice, it may not be meeting the needs of those individuals. And then lastly, just really wanted to highlight these additional resources. So it's kind of broken out into each of these different subheadings. So law enforcement resources, these are all links, courts and supervision, correctional institution resources, and you can also see some of these ones, and then national registries and resources for evidence-informed and evidence-based practices. And these are also just really helpful in identifying just like what works, consolidation of information, and information on programs and practices. And that, with that, I will take questions, or I kind of want to help answer any questions that other individuals might have, and maybe areas that I didn't hit on.
Thank you, Lily. You've really put together a wealth of knowledge there, a lot of great resources for both researchers and practitioners. So I don't see any questions yet, so while you guys are typing in your questions into the chat box, I'm going to go ahead and have Jason start the evaluation poll for us. So that poll will probably block your view a little bit there, but don't worry, you can reopen the chat box once it launches. But please go ahead and enter your chats in. You can send them to host, presenter, and panelist. So I have a question for you, Lily. Going through those resources and all the different programs that are out there, and you talked about how important implementation is. I was just curious, you know, how many of those programs are transparent about sort of implementation guides or training guides, or is there a big price tag that comes along with a lot of those? Or, you know, what would sort of be a recommendation if a practitioner is sort of looking for, okay, this seems like a program I want to implement? What would be that next step?
So I think the next step would really be that kind of getting a group of stakeholders together to really discuss, you know, I think what is currently out there, kind of just to go through and flesh out, well, if this is something that we need, what would that look like? And the National Implementation Research Network, or NIRN, as it is called, has a lot of great tools to help in the planning part of implementing anything, as well as what that means for continuous quality improvement and how to best sustain. Now, a lot of their examples come from education and youth development, but are readily and easily applied to criminal justice programs and practices. And they actually kind of formed out of a multidisciplinary approach, looking at how businesses implement processes and policies and programs. And taking human services and social services and kind of putting that all together and kind of saying, well, here's what we would need to do this. Here are our strengths. Here's what we're missing. But as prior to ICJIA, I worked at the University of Cincinnati Corrections Institute, where I did a lot of training and trained the trainers. And I think the biggest thing is informing people up front as to what they're going to be expected to do, but also getting buy-in from individuals that are at the line staff level, the ones that are going to be the people that are going to be essentially delivering this product or this service to clients, because they're going to have the most direct impact on individuals. And I think support from the top down and down to the top is going to be really important. And I think that really just comes with education around the topics and kind of really knowing what's going on. I know Policy Research Associates does local SIM mapping and can really help at least at the individual level. But what I'll say is that sometimes programs or practices might be a little bit more set up front and cost up front, but that they pay out more in the long term. And I think the one downside is that, the legislatures aren't always necessarily about long-term impacts. And I think we would all like to see things have quick responses, but that it takes time to really get it right, and that getting it right can be one of the best things and best programs that your agency could have. So I always recommend National Implementation Research Network resources, and they have their own activity hub, and they have activities you can go through with your organization as well that I think are really helpful.
Yeah, that sounds great. Thank you.
I guess the other downside is that sometimes you don't have a planning period.
Right. Well, yeah, and like you were saying, people expect instant results, and that's not probably never realistic.
Yeah.
So we had one question come in here for you. What other topics might be suitable for a continuum like this?
So what you'll see in October is one about mental health disorders, but I can also see violence prevention and intervention, which can be pretty broad as to programs and practices, and maybe a pretty deep undertaking. Victim services, which is also kind of a great way to help on the victim side at each of those points, like where they can get help, could really be used. I mean, if you put some stuff in conjunction with this one and the mental health disorder one for co-occurring disorders, because there is some overlap in co-occurring disorders, especially some of the programs and practices, even for domestic violence or intimate partner violence, really kind of any broad topic that impacts people in the criminal justice system would be helpful. And I believe we have an article on our website that was written by a couple of coworkers who go through evidence-informed and evidence-based practices or trauma-informed practices. And, all those types can be also integrated within substance use disorder practices and treatment and things like that as well.
Great, yeah, looking forward to that October webinar. So any more questions, anyone? Please enter them into the chat. I know we still have a few people on the line here. Any remaining questions for Lily while we have her on the line? All right, I'm not seeing any come in, but if you guys think of any after we conclude today, please feel free to get in touch with me or Jason or Lily as well.
Yes.
So I want to thank you, Lily, and everyone in the audience for joining today. We hope you enjoyed the presentation and will enjoy us for our future webinars, including that one on October 24th. So please register for that one. Thank you again, and have a great afternoon.
Thank you.